Hi, this is Karen, aka East Coast Girl 1975. Checking in today is November 29th, 2011, and I had my slim band surgery 1 week ago today. It's been a little bit of a tough week, I must say. I flew to Toronto for the surgery last week. The process at the actual clinic was very efficient, I must say. Checked in and filled out some patient information, had a quick chat with the doctor, went in for my surgery, and I recall being in recovery, waking up, and the nurse saying, "So it's done, your surgery's over." My reaction was, "Really?" From there, I went to a nursing home that does care for slim band patients. The room was sort of like a hotel room except with a hospital bed. A nurse checked in on me a couple of times that night to see how I was doing. She did change one of my gauze bandages because there was still some bleeding at the port site. That night was a really rough night. I was very nauseous and had the dry heaves a few times. Didn't bring up anything but gas. The next day I flew home to Nova Scotia and slept a lot the next few days. I had a lot of gas pain in my left-hand shoulder, like everybody talks about. Had a lot of gas pain there, and had a lot of chest pain as well, and it kind of came in waves. And I gotta say, I've never had a heart attack before, but that's gotta be what a heart attack feels like. But according to all the nurses that I've talked to at the Slim Band Clinic, it's pretty common. So my surgery was Tuesday, and I would say by Sunday, those gas pains were getting less and less severe as well. Monday I went back to work, and I was at work again today. First day back at work, I was really tired. I have a desk job. Today though, I'm feeling pretty okay. I've got energy. Everybody tells me I look tired still, who knew I had the surgery. Yeah. Not a whole lot else to report going on other than the numbers. When I arrived at the Slim Band Clinic, one of the things that they did before surgery, of course, was to weigh me, and I weighed in at 245 pounds, which means that from the date of my surgery, I was 80 pounds away from my goal of 165. So I was kind of proud of that, to lose quite a bit pre-op and have 80 on the nose to go. Weighed in today at 238.6, so I'm down 6.4 pounds in the week post-op, first week post-op, which is to be expected. The Slim Band diet post-op is basically clear liquids for the first 5 days, so anything you can see through, so apple juice, that kind of thing. And then yesterday I started on what they call full liquids, which is your protein shakes, anything that fits through a sieve. So I've been having like Campbell's soup, like cream soup. I've been putting it in a blender and then through a sieve just to make sure that I can eat it, and yogurt without any lumps or bumps in it as well. So down 6.4 pounds in my first week, which means I am down a total of 23.4 pounds altogether since my journey started. And I'm excited about that. I've actually a couple of non-scale victories, I guess. A few people at work have said they can see it already. Now, those are people who knew I was going in for the surgery, but it still felt good. And I kind of see it myself in my face a little bit. So I mean, that's good, and feel it in my clothes, and it can only get better from here. I can't help but think, a lot of the things that I've been doing, I think next year I'll be skinny when I do this, and like taking down the Halloween decorations, thinking about next year, where I'll be at. And I'm encouraged, and even a few weeks before I went in for surgery, I actually organized my closet by size, because it's not like I don't have smaller sizes. I've kept a lot of my smaller clothes, the quality pieces that I think someday I'm going to wear, and organize those by size, and I've been able to fit into kind of the next size down, which is kind of exciting, and packed away some of my summer clothes as well, and packing away, I couldn't help but think, oh, I hope next summer when I go to pull these out, these would be so big on me, and here's hoping for that. Alright, so thanks a lot for watching. Again, this is me chronicling for my own records, and for me to look back on myself, but I know some other people have subscribed to me, so thank you for watching and joining me on my journey, and to everyone who has been recently banded or about to be banded, good luck to you all. And if you're post-op right now and feeling the pain, because it's painful, it doesn't last long. You'll come out the other side and you'll be feeling back to normal before you know it. And today I'm feeling back to myself. Okay, so thanks again, and we'll see you soon. Bye.